Hello friends and welcome back to our channel Longani Clinics. In homeopathy, the symptoms are the true guide to selection of the similima. But did you know that the different stalwarts of homeopathy have classified symptoms in their own unique way? Today, let's us understand how our masters like Hahnemann, Bonnigesson, Bogar, Kent, Robert, Hughes and Allen look at the symptom and their importance in prescribing. Different homeopathic stalwarts, our masters, they classified symptoms in their own way based on the clinical importance, philosophy and utility in prescribing. Here is a structured outline for you. The first one is our master Dr. Samuel Hahnemann. Hahnemann explained that the disease is not a material thing but a disturbance of the vital force, and the only way this inner disturbance can be known is through the symptoms. For him, symptoms were the language of the vital force, the true expression of the disease, and therefore the only reliable guide for the treatment. He emphasized that it is not the disease name but the totality of symptoms that represents the real picture of the patient. Among these, mental symptoms and peculiar, strange, rare features were most valuable because they help us to individualize one patient from the another. For example, two people may both have cough, but one gets worse in warm room while the other feels worse lying down at night. Even though the diagnosis is same, their remedies will differ because of these two peculiar symptoms. In this way, Hahnemann taught that symptoms are not mere complaints but the very key to understand and curing the patient. The next our master is Dr. J.T. Kent. Kent emphasized that in homeopathy, not all symptoms are of equal value. He gave the highest importance to the general symptoms, especially the mental generals, because they represent the whole patient rather than just a part. Then comes the physical generals like desires, aversion, sleep and thermal state. They come next, while particulars or local symptoms are considered only after the generals. Common disease symptoms such as fever, cough were given the least importance since they do not individualize the patient. He also stressed that strange, rare and peculiar symptoms are the real keynote symptoms for selecting the similima. For example, in a case of fear or in a case of fever, one patient may feel extremely anxious and restless at night, pointing towards the arsenical, while another may simply want to be left alone and stay in silence, suggests the bryonia. Thus, Kent's method guides us to focus on generals and peculiar symptoms to find the true and rational remedy. Then our next master is Dr. Bonnigesson. Bonnigesson looked at the symptoms in a very systematic way and introduced the idea of the complete symptoms. According to him, a symptom is complete only when it includes four aspects: location, sensation, modalities and concomitant. He believed that without these elements, a symptom is incomplete and less useful for the prescription. Concomitant symptoms, meaning those unrelated complaints that accompany the main suffering, were great or they were the great importance because they help to individualize the patient. For example, a patient may complain of burning pain in the stomach after eating, which becomes worse from warm food and is accompanied by headache. Here, the location is the stomach the sensation is burning. The modality is worse after warm food and the concomitant is headache. Such a complete symptom gives us a clear characteristic picture for the remedy selection. The next one is a Dr. Herbert A. Robert from 1868 to 1950. Robert emphasized that not every symptom has equal value and heightened the importance of what he called eliminating symptoms. These are the peculiar, strange, and guiding features in a case that helps to narrow down the choice of the remedies by eliminating those do not match. He arranged the symptoms in hierarchy, giving first place to mental symptoms, then physical generals, followed by modalities and particulars, and lastly the common symptoms. For him, the rare or peculiar symptoms is like a key that unlocks the case. For example, a patient with cough may say it comes on only when entering a warm room. This unusual modality acts as an eliminating symptom, quickly ruling out most remedies and pointing strongly towards the pulsatilla. In this way, Roberts taught us that the peculiar and eliminating symptoms are the real guideposts to finding out the simillimum. The next one is a Dr. Richard Hughes from 1836 to 1902. Hughes approached symptoms from a more practical and clinical angle. He divided them into three types: pathogenetic symptoms, which come from the drug proving clinical symptoms, which are observed in patients cured by the remedies, and common symptoms, which belongs to the disease itself and hold little prescribing value. For Hughes, the strength of homeopathy lay in combining the evidence of proving with clinical example or clinical experience. For example, belladonna in provings produces dilated pupils and throbbing headache. These are pathogenetic symptoms. When the same remedy cures a child's high fever with a flushed face and glaring eyes, this becomes the clinical symptoms. But general complaints like fever with weakness are only common symptoms and are of the least importance. Thus, Hughes gave highest value to the symptoms that showed both proving evidence and clinical confirmation, as these offered the most reliable foundation for the prescription. Next one is a James Henry Allen. Allen viewed symptoms mainly through the lens of miasms. He believed that every symptom expressed the deeper influence of an underlying chronic miasm, such as psoriasis, psychosis, or syphilis. For him, classification of symptoms was not only about the generals and particulars, but also about tracing them back to their miasmatic origin. For example, itching eruptions that get better by scratching belongs to psoriasis, while warts, tumors, and excessive discharges are linked to psychosis, and destructive ulcers or bone pains at night indicates the syphilis. In practice, Allen taught that by understanding which miasm lies behind a patient's symptoms, we can prescribe more deeply and permanently. Thus, symptoms for Allen were the surface signs of much deeper miasmatic disturbance. The next one is C.M. Bogar's concept of symptom. Bogar refined Bonninghausen's idea and gave special weight to the time modalities, pathological generals and concomitants. He believed that knowing when a symptom appears and under what circumstances can be important as the symptom itself. He also valued pathological tendencies that shows the direction of disease in a patient, such as tendency to develop kidney stones, tumors or recurrent fevers. Concomitant symptoms, those unusual complaints that accompany the main suffering, were also highly prized in this method. For example, if a patient complains of headache that always comes at 10 am and is accompanied by nausea, this time modality and concomitant symptoms provide a strong clue pointing towards the remedies like natrum mur. Thus, Bogar emphasized a precise systematic approach where time generals and concomitants guide us to the simillimum remedy. Now let's understand it through the chart. In this way, each stalwart gives us a different perspective. Hahnemann stressed the totality and peculiar symptoms. Bonninghausen the complete symptom. Kent the importance of generals. Bogar the role of time and concomitants. Roberts the eliminating symptom. Hughes the balance of proving and clinical evidence. And Allen the miasmatic basis of the disease. Together, their insights from the rich foundation of homeopathic philosophy and the practice. Now we will see the concluding part. So friends, each homeopathic stalwart emphasized different aspects of symptoms, from Hahnemann's characteristic symptom to Bonninghausen's complete symptoms, from Kent's generals to Allen's miasmatic classification. This comparative study helps us to understand the depth of homeopathy and guide us in selecting the right remedy for our patient. If you found this video useful, don't forget to like, share and subscribe for more insights into homeopathy. Thank you for watching.